Hi everyone, and welcome back to yet another episode of the Mommy and Baby Show. I'm your host Mercy Tetu, and today we are looking at something different. We finally have our child with us. We've labored through the 9 months. We delivered, and now we get to hold our baby in our arms. So you can be sure that today's episode is going to be full of practical sessions. It's going to be even more empowering and more informative. And joining us today is Nurse Damaris. Thank you so much for being here.
Thank you for having me.
She will be showing us practically how to hold our baby, how to breastfeed when it comes to changing a diaper as a first-time mom, all these things and more. And just before we dive in, kindly just tell us a little bit more about who Nurse Damaris is.
Hi, everyone. Thank you so much for having me here, Mercy. And my name is Damaris. Thank you, Mercy, for having me here in this episode 9.
Yes.
Yeah, where we will be talking about everything care after birth.
Mm-hmm.
So I'm a registered nurse here at RFH, Kiambu Road, where we help mothers during delivery and also after birth. And also we give mommies practical skills, hands-on, we teach them, and also we reassure them through the motherhood journey. Yeah.
Thank you.
Yeah.
So let's just get started.
Okay.
Finally, I have my baby. Mm-hmm. I just delivered. I'm still in the delivery room. So what are the immediate steps taken right after birth?
Okay. So now we have mommy and baby. Mm-hmm. We've already delivered the baby, right? Mm-hmm. So right after delivery, I'm going to start with the vaginal delivery, the normal delivery, as everybody knows.
Yes.
So we place the babies on the mommy's abdomen. Mm-hmm. So we'll talk about skin-to-skin contact later.
Okay.
But which is important in the first time when the baby is born. So you prepare to cut the cord when the baby is on the mama's abdomen, and then you dry the baby to ensure that he or she is warm. Okay. So you cut the cord and then you dry the baby. The normal baby temperature should be 36.4 to that's 7.5.
Okay.
Yeah. So you keep the baby warm and then you go ahead and do the cord care.
Okay.
Yeah.
And all this time the baby is, once you do that, the baby is on my tummy.
On your tummy. We wipe the baby, we keep them warm, and then now you show the mother the baby.
Yes.
Yeah. So for them to confirm the gender, they confirm the gender themselves.
Oh yes, yeah. Actually. I was saying, and it's actually something I've experienced. They show you and ask you, you can see your babies, Then you say it's a boy, it's a girl.
It's a boy.
Oh, okay.
So we have keeping the baby warm, then you have cord care, and you can initiate the first breastfeeding pain if the child is stable. Okay. Or later.
Oh, okay. So, and what about the mom? Because now you've delivered the baby, you've dried the baby is warm, you take care of the cord. Then what other steps do you take for the mom?
You have the first assessment of the newborn at 1 minute of birth, at 5 minutes, and at 10 minutes. Okay. So it's called an gas score.
Okay.
Yeah, above 7 is okay. Below 7, that's when we need to resuscitate the baby. But that's when you hear that the baby has been taken to nursery and then they are on oxygen, for example. So that's the immediate care of the newborn.
I have a question. When you say the baby, if the gas score is below 7, is that when the baby doesn't cry?
Okay, good question. Now, when you are keeping the baby warm, you're wiping the baby, right? So you're trying to stimulate the baby to cry. Okay. So a crying baby is a breathing baby.
Yes.
But when the baby takes longer than 1 minute to cry, you are sure maybe they're not breathing. So you need to stimulate more
Ah.
by just that rubbing.
Okay.
Yeah.
Also, it's not usually just rubbing. You're actually doing that with a purpose.
Yeah. You're doing it thoroughly, but also gently on the baby's skin.
Oh,
Yeah.
okay. So now we've spoken about the baby. What steps do you do, or what steps are immediately taken for the mom who just delivered?
Okay, good question. Now we've already delivered the baby and kept them warm. We usually have a resuscitator. It's usually warm, so the baby is there. And then let me take you back a bit. So we also give the medication that we give for the baby. We give vitamin K, which prevents further bleeding after we've cut the cord, right?
Yes.
And also we take care of that cord by applying something we call chlorhexidine digluconate 7.1% on the cord. It prevents infection on the cord.
On the baby's
Yes,
navel.
that's immediately after you've cut the cord.
Okay.
And then you also give some eye ointment. It's called tetracycline eye ointment. Yeah, to prevent any infection on the baby's eye. So we go to the mommy. Now we've already separated the two. After we've separated the two, you administer a drug called oxytocin within 1 minute after you've separated the mama and baby. That oxytocin help the next step that I'm going to talk about, the delivery of the cord, the placenta inside the mommy. So it eases the contractions and helps you to deliver the placenta.
Okay. So also immediately after, but I'm not really sure, but you can tell us. I've heard that there's skin to skin is quite important. Maybe you can tell us why that is. And if that always happens, because I've heard of other moms who say, I actually never had my baby placed on my skin. I never experienced it. So did they miss out on anything?
That is important. Actually, the other institutions that recommend even your partner can have a skin to skin with your newborn.
Okay.
Yeah, it helps transition the baby from the womb, environment, and then here she is. Yeah, it helps that bonding, create the bonding, and also skin to skin helps with keeping the baby warm. You see, immediately we are removing the baby from the birth canal.
Yes.
We are placing her or him on the mommy's abdomen. So that warmth, it's good to be received by warmth when you are new to a certain environment, right?
Yes.
Yeah, it also helps to with the pulse rate of the baby. Okay, during assessment of the APGAR score, we also assess how the pulse is. So it also helps with the pulse rate and also the respirations. In the 1 minute of birth, we usually assess the respirations too. So it helps with that. And also it's a good bonding time for baby.
Yes.
For mommy or maybe daddy.
Oh yes, good. Yeah, I've seen pictures. I haven't seen it in real life.
Actually, let me cut you short. Actually, as a new mom or as a mom, any mom can request that skin to skin. You can tell your midwife, I want a skin to skin contact immediately my baby is born. Yeah.
So, that's nice.
Yeah.
Because now at least we know moving forward for any future babies for other mothers, they can always request that.
Actually, also when you're having a cesarean section, there are other hospitals that also allow that bond. Yeah.
Oh, all right. So we've also complications can arise in any circumstance. What are the most common post-birth complications you've come across?
Good question. So I'll start with the mama. So for the first 1 hour we've delivered a mama, you must monitor that mother every 15 minutes. What are you monitoring for? The vital signs. That's the blood pressure, the pulse rate, and also now you must keep massaging the uterus to help the uterus to contract and dispel any clots that are left inside. And also we advise mothers to wear a pad so that we keep monitoring them for any vaginal. Okay, there will be bleeding, but now how much? That takes us to the next complication. We have postpartum hemorrhage that can happen within the first 48 hours or a few days later. So that's why we keep monitoring the pads on how many pads have you changed? Was it full? Was it moderately? How much? Yeah.
Okay.
That's one complication.
Yes.
And also you can get an infection. In this case, I'll give a scenario of a urinary tract infection. So we advise mothers to keep hydrated, take a lot of warm fluids. Take a lot of warm fluids, and also there are antibiotics usually prescribed for the mother. So take antibiotics within the given and prescribed period of time. And also, is there any? There are many complications.
There are many complications.
Yeah.
So, but like the most common are like the hemorrhaging.
Yeah, that's the most common.
That's the most common. All right. Okay.
Yeah.
So I also wanted us to talk about how soon the baby starts breastfeeding. So yes, the baby has been delivered, baby has done skin to skin, but now when you're assessing the mom, I'm guessing you say the baby is placed elsewhere. So how soon can this baby begin to breastfeed?
Okay, good question. Within the first hour of birth, according to the National Guidelines of Quality Obstetric and Prenatal Care, they suggest that within the first hour of birth, that the skin to skin has already been initiated, and then the breastfeeding has already been initiated. Also, the WHO.
Oh, they also state the same.
Yeah.
So what if this is a mom who does not have milk? What happens?
Okay, that's another golden question. Because now I'm about to tell you the golden rules of breastfeeding. So if a mother doesn't have milk, demand is equals to supply. So the more you're breastfeeding, the more the letdown comes. The more you're telling your brain the baby is here, they need milk. So the more the system will continue producing milk. So here comes the watery milk, the colostrum, which is rich in proteins and antibodies. So demand and supply. So we encourage mothers to keep breastfeeding. And also we encourage them to take a lot of warm fluids. Don't take cold fluids. Warm fluids it's better. So keep hydrated, and also
supply.
And also we have lactogenic granules.
And what is that?
So those are kind of supplements that help improve the production of milk. They support milk productions.
So
other people may tell you to take cocoa.
Yes. Eat certain foods. So, but I'm still in hospital, and you're encouraging me as a new mom to keep trying to breastfeed my baby. So do you give me those supplements if I'm not able to produce milk?
Okay, currently in our pharmacy, there are supplements. So like we give you supplements.
Okay. So do you have a timeline? Like this mother has not been able to breastfeed for like maybe 2 hours. Now this mother has to be given supplements. Is there a timeline, or do we just give supplements if we feel, okay, you've tried, there's nothing, here you go? How does it work?
Okay. Actually in the gynecological clinics, the antenatal clinics, when you are almost finalizing them or coming to an end, the gyna can recommend you to start taking the lactogenic granules before. Yeah, so that it can stimulate milk production.
And in your many years of experience, I don't know if you mentioned that. Have you seen moms who were not able at all to give to be able to give the breast milk?
Yeah,
It happens.
It happens, and now we have to supplement. We have the non-supplement, for example. Yeah,
But that is maybe by the time they are being discharged to go home.
Actually, one thing why we keep mothers, we'll be able to say that about the hospital, how long we stay in the hospital.
Yes.
One reason why we keep you in the hospital is to establish whether you've been able to breastfeed your baby. So when we are discharging you home, we are discharging you knowing that mama has breast milk. Yeah.
Yes.
And then we do a follow-up whether your milk has come.
Okay. All right. So now we have our baby breastfed. Our baby has been assessed. Mommy has also been assessed. Labor or rather delivery can go either way, right? So some moms will have what we call tears, which if you haven't given birth, you are so afraid of, because unaambiwa, hey, jaribu, don't push when you don't need to, you don't want to tear. But now let's say you already teared. How does wound care look like for that mom? And also, next question, let me just say it now. If I didn't do the normal delivery, how am I supposed to take care of my CS? Is it a CS wound? Yes.
Okay. For the normal delivery, you have a tear. For example, in this scenario, you have a tear, or as a midwife, I give you an episiotomy. An episiotomy is that cut with the now scissors. So you have a tear or an episiotomy.
Before we continue, what makes you give the mom that episiotomy?
Okay, when let me just say the pathway isn't sufficient for the baby to come out. Yeah.
So you're creating more space.
Yeah. You'll find that happen especially for first-time mommies. Yeah.
Yes.
So instead of you getting a big tear, I may do an assessment and just judge and give you an episiotomy. Yeah.
Okay, so that will result in the first tear, or it will result in either tear.
Okay. That may result to, we have 4 degrees of tears.
Okay.
The first degree, the second, the third, and the fourth.
Okay.
So as we go down the graph, that's how it gets worse.
Okay.
Okay. So for the first degree of tear, you may or not get stitches. And now for the second, third, and fourth, that is, you will get stitches.
Yeah, it's a definite.
It's a definite that you will get stitches.
Okay.
And now we go ahead to the care of the stitches. Okay. Now we have something we call sits, but like SITZ.
Oh, sits, yes.
Yeah,
but sits, yes.
Yeah. So your gyna may recommend you to sit on salty water. Yeah. So every for 2 to 3 times in a day, you sit on that salty water. Okay, number 1 care. Also, it's a golden rule. It's hygiene.
Okay.
Hygiene is very important for any wound to heal. A clean wound is a healing wound. So once you sit on the salty water, it cleans out any debris or something. So once you sit on the salty water, you dab the place dry kabisa, completely. Yeah, so keep the area dry.
So let me just ask a question before you move on. Sitting on the salty water, I'm still taking my showers every day. I deliver normally, but then I also create time to sit to sit in the salty water.
And actually, we have more improvised basins nowadays in the baby shops.
Okay.
So the ones that you can place on the toilet bowl and There's a way, yeah.
Ah.
So they're bringing more comfort.
Okay.
Yeah.
So for the mom who cannot maybe get that, can you improvise? I've heard that you can make, you have a bottle, on the top, on the lid, you create holes. Then you spray that, or you use a peri bottle.
Okay, exactly.
Is that the same? Can I use
There
a peri bottle and not sit in a bath seats?
Sits bath.
Yes, that one.
Yeah, you can do that. Yeah, you can do that because now that water goes all over the perineum. Just make sure the whole of the perineum, the perineum, by the perineum I mean the whole of the perineum.
Yes,
gets
your vagina all the way to your anus.
Yes.
Okay.
It's well washed by the water.
Okay. So okay. The reason I was asking is just so, because it might seem like it's a lot of work to go. I put my basin on top of the toilet. I sit down, but then I've heard that you can do the bottle.
Yeah,
just
you can
lift your leg and spray underneath. So that still works as well.
Yeah, just make sure the whole area gets a good amount of the wash.
Okay.
Yeah, and then you keep the area dry after that. And now we are still on the care of the wound, the tear, the episiotomy.
Yes.
So there are also drugs, antibiotics that you are sent home with. So just make sure you finish the whole prescribed dose. And also hydration. It's good to keep hydrated because the more you pee, the more any infection is swept out. So that keeps you off of any urinary tract infection. And then there's diet, nutrition. It's good to maintain a balanced diet.
All through.
Yeah, when you have a wound, it's good to maintain a well-balanced diet. More proteins, vitamins,
okay,
to promote the healing of the wound.
Okay.
Yeah.
So that covers the vaginal delivery. What if I had a CS delivery? How do I take care?
I've had a CS.
Oh, personally. Oh.
So maybe I may speak from experience and also the medical
bit of it.
Bit of it.
Yeah, that sounds good.
Now we are taking care of the CS wound. So number one is hygiene. Other gynecologists may tell you to wash your whole body.
All right.
Yeah, so when you stand in the shower, you just wash your whole body, including the sides.
Okay.
And then you pat dry the site. Always make sure that the site is dry. And also you wear loose clothing around the site. Don't press on the site so much.
Okay.
Don't wear so much fitting clothes to ensure circulation and the healing also.
Okay.
So we have also antibiotics. The prescribed antibiotics. Just make sure you finish the antibiotics. And also, within 24 hours after the CS, we encourage mothers to ambulate. Ambulating means walking.
Okay.
So we support them if maybe they don't have the strength yet. We support them to walk with the correct posture, standing upright. Don't walk like this, bending. Don't press on the wound. So that's ambulating. And also we encourage hydration also. Yeah.
So is there a timeline, like, because I feel like a CS wound is really, what's the word? It's more serious than having given birth vaginally.
Okay.
So am I encouraged to start walking immediately, or can I take time, maybe 3-4 days? Because it's like a really big wound, then I can now start walking.
So it's usually within the first 24 hours.
Oh yes. Oh
yeah.
Wow.
So
okay.
after like 6 hours after surgery, we give you time, and this time we are giving you antibiotics and also painkillers.
Yes.
So if you're having pain, just tell your nurse or your midwife. Yeah. So it's within the first 24 hours.
Okay.
Actually, you may hear the nurse or your doctor telling you the earlier you're able to walk, the faster the healing of the cesarean section. So even when you go back home, continue walking. Every day, just make sure you have walked a certain distance. Yeah.
Okay.
Yeah.
So now I want us to get into breastfeeding.
Okay.
How do nurses support moms with breastfeeding?
Okay. We've talked about starting breastfeeding within the first hour of life. Now, as a nurse, I'll teach the mother how to attach the baby, the correct positionings. Yeah.
Okay.
So that's one of the ways we support the mother.
Immediately during the whole thing that we do the assessments, we'll take care of the wound, and now how we'll breastfeed. Okay, we'll jump into that where you can show us practically some of the breastfeeding positions, what makes you comfortable as a mom in breastfeeding. But before you get into that, I also would like to know, what are some of the red flags you should watch out for with a newborn?
We have several of them. The first one that you note is the appearance of the baby. If your baby turns blue, that's a red flag. A normal baby's skin, a well perfused or with good high oxygen and blood, is usually pink. So once your baby turns blue, you call your nurse. Yeah, and also pale. You can look at the skin and judge it's pale. And also, when you as a mother, anytime you sense something is not okay, it's not okay. You're right.
You're right.
Yeah.
Do not second guess
call
yourself.
your gynae if you're at home, or your nurse if you're in the hospital. Yeah. And also, we recommend you checking your baby's temperature even at home. If they have a fever, that may mean many things. It may mean there's an infection. Yeah.
Okay.
And also we have elimination. So within the first 24 hours, the baby needs to have peed. So, yeah. And then within the first 48 hours, we need the baby to pass the first stool, which we call meconium.
Oh yes, actually that's something I remembered and I thought I'd ask it later, but thank you, you've already mentioned it.
Yeah.
Yes.
So there's that. And also, if the baby's tummy is full, you may look at your baby's abdomen and judge it's not okay.
Okay.
Yeah, that also can make you know it's a red flag.
All right.
So and also,
yes,
if the baby is not breastfeeding,
like you're trying but the baby is refusing.
You're trying but the baby is refusing. Or maybe your baby used to breastfeed and then they are no longer breastfeeding. That also is a red sign. It's a red flag.
It's a red flag. Yes. So we talked about having given birth either vaginally or through CS. How long is a typical stay for either mom in the hospital?
That's a good question. So according to the WHO, they recommend a 24-hour hospital stay if a healthy mother and a healthy baby. A healthy mother gives birth to a healthy baby. So 24 hours.
Yes.
So for a cesarean section, they say that it's not safe for a mother to stay for 24 hours. And then we have the social health insurance funds, the SHIF.
The SHIF, yes.
So they cater for a cesarean section. You'll find them giving a maternity package of 3 days for a cesarean section. And then for a normal delivery, not more than 2 days.
Okay.
So normally, if it's a cesarean section, 3 days is okay, because now we are finishing the intravenous antibiotic course for the 3 days. And then remember, we are opening the CS wound the 3rd day.
Oh, before you leave hospital.
Yes, before you leave hospital, so that the doctor assesses the wound. Yeah.
Okay. So that will be 3 days for CS.
Yeah.
For a normal delivery of vaginal is 1 to 2 days.
24 hours to 48 hours.
So I can give birth today and go home tomorrow. Oh,
Yeah.
okay. So before we go into our practicals, I would like to know what kind of support can moms expect once they've been discharged?
Wow. Here at RFH, after they are discharged home, we usually we discharge you after we've established you're able to breastfeed your baby, or if it's exclusive breastfeeding, that is. So we discharge you after you're able to breastfeed your baby.
Yes.
Yeah. So we book you in for a clinic with your gyna 2 weeks after
Delivery. Okay.
So we book you in, and then there are vaccinations that the baby received. Remember the BCG and the polio.
Yes.
So it's usually given within 2 weeks of birth. Yeah. So if you're not able to get within the hospital stay, we give you a date to bring the baby back within the 2 week span. And then
do you follow up with moms to find out how they're doing, to find out if they're experiencing any challenges?
Yeah, we have an initiative at RFH where we follow up moms.
Yeah.
And also we bring together mommy alumni and babies and celebrate them.
Oh, that's nice.
So we usually do a follow-up.
Okay.
Yeah.
Actually, I remembered we had some moms here on the show sometime. Actually, they're RFH moms.
Oh, really?
Yes, and they had really good things to say. They say you still call them. You remind them, come for well baby clinic, come for your vaccinations, you check up on them. So I'm sure I'm a believer now that as a mom and you've delivered at RFH, you still have that support once you've been discharged.
Yeah, I remember we booked them, we take their contacts, and on that particular day that you're supposed to come for the clinic, we give you a call. Hey, are you still remembering of your clinic day?
So they never.
How is baby doing?
Oh. Yeah. And moms love to hear that baby. I remember with my first child, when I think I took him for clinic, just a random hospital. And the gyna, I also happened to see the gyna at the same time. And I remember she just asked me, but how are you doing? And it felt so good. She did not, just that question, how are you doing? So I know that support for moms is very, very crucial. It means a lot.
Funny thing is, most of the times people focus more on the baby.
They
and
do.
Forget the mama.
They do.
So once you check on the mother and ask them how they are doing, that's important.
Yeah, it makes a difference. So I think we've covered what I wanted us to cover in theory. Is it theory? So maybe we can skip to the practicals. We can at least see now with not a real baby.
Okay,
with the beta dummy, because now the baby has been waiting for us. But now we can show the viewers at home how to do some of these things. That will be okay?
Yeah, that will be fine.
Okay, I guess let's look into that.
I just thought about something.
Yes.
About one of the complications of birth.
Yes.
To the mother.
Oh, the postpartum.
The psychological support. You have the postpartum blues, the postpartum depression. Yeah, and the postpartum psychosis.
Whoa.
So when you're giving the mother that call, it helps she can tell you what she's going through. Yeah.
So the last one, the postpartum psychosis, what does that mean? Or what does it entail?
No, that's the far end of the depression.
Oh.
Psychosis is like when
yes. I wanted to ask, do they go crazy?
Yeah. See, they usually say psychotic. So psychosis is when it's too much. The depression is too much. It has weighed the mother down. She's no longer bathing. She even doesn't no longer know the child is hers. So it's getting bad.
Okay.
So here we must admit the mother
Yes.
to hospital, and other times you get that they are being put on antipsychotics. Those are medication
Yes.
to
Stabilize the mother.
stabilize them.
And does it affect the child? Because I'm breastfeeding and I'm taking meds. These meds will not interfere with my breast milk.
Now, the doctor will prescribe meds according to the ones that won't cut down on the milk.
Okay.
And if they will, he will prescribe some supplements. Maybe the most common non-formula.
Yes.
Yeah.
Okay. So, like you mentioned, you keep checking in with the moms. So they're sharing how they're feeling.
Yeah.
Are you able to deduce that this mom is now moving from, it was just baby blues, she was just crying, now it's getting into depression? Are you able to find that out? And are you able, maybe you can give us an experience, able to call that mom back in before it goes now to the deep end?
Okay.
Maybe help her along that?
I don't know why I feel like every new mom, or maybe it was just for me.
You can tell us about you.
Maybe it was just, but I feel like every new mom, or myself, is really fighting postpartum depression, like myself, because this is a new phase. This is a new human being you're starting to take care of. You've never met them. You don't know why they are crying. You don't know why they are crying. You don't know what to do next. Okay, it's a whole lot of things.
It is.
So I myself experienced postpartum blues.
Oh,
I could look at my child and cry because I don't know why they're crying.
it makes you cry as well.
Cry as well, but with a supportive partner or people around you,
Yes.
it helps. So I think I would just tell mothers, accept help. Don't think that you can do everything yourself. Get enough rest.
Yes.
Love yourself a little bit. You know, if you've spent the whole 3 hours with your baby, get some 30 minutes to yourself.
To yourself, yes.
Go cool down, have a walk. Maybe you won't be able to go on a date by yourself, but have some you time also. Because for me, I felt I was so selfish with my baby. Like I can change the diaper, like I can feed them.
Yes.
So
Feed
like I
them,
didn't have time for myself. It was a whole lot of baggage. So but by the second week I isn't, and I just allowed people to help me out.
Oh, that's actually good.
So it didn't get to depression.
It did
But
not.
yes, I had the postpartum blues.
Okay.
Yeah.
So mom should always remember they cannot do it
They
all alone.
They can't do it all alone.
They need support.
You need support, and this is a new journey you're beginning.
It's true. It's true.
And we also need you at the end of all these things. Don't be so sunken in the motherhood cloud.
Yes.
Yeah. I guess that's what you mean.
That's actually true. I agree, because like you said, by week 2 you had isn't. I think by year 2 is when I was isn't. I don't think I was allowing people. And I will change him. I will wash him.
Yeah.
I will soothe him. Yes, I'm feeling like it's being overwhelming, but yes, I think once you learn that, it becomes a little bit easier.
Yeah, it becomes a bit easier.
Okay.
Yeah, a mother can be selfish with their newborn.
Yes, we are. Okay, so I guess let's jump into the practicals.
Okay.
Let's learn how to wash babies, because all these things, especially for a first time mom, are scary. So at least let's get to show them how to bathe this baby, change the baby, feed them. Yeah, so I think we'll jump into that right up.
Hey.
So we're back, guys, and we are here with our baby. And Nurse Damaris will now take us through and tell us a little bit more on how things go. Nurse Damaris, I see we already have a baby. I don't know, is our baby a girl?
She's in pink.
Yes.
So she's a girl.
Does she have a name?
She is Baby Mercy.
Wow.
And she says, "Hi, guys."
All right. So we want to learn how to wash our baby because, like we said, it's usually a nerve-wracking time for a new mom. So you'd like to know how to correctly wash our baby when it comes to that time. So
Okay. So ensure the room is warm.
okay.
And then you prepare everything, the baby's clothes, so that you don't have to keep rushing, finding for any other items.
Yes.
Now we have Baby Mercy here. Do you mind holding her for me?
Okay.
So this is our bath station. So we already have our water. So you test the temperature of the water first.
Okay.
So there are two ways of testing. If you don't have a water thermometer, there's the elbow, which is your sensitive part, one of your sensitive parts. So
Yes.
you just dip your elbow like this.
Yes.
And then, that's how you check the temperature.
All right.
And then Baby Mercy here with me. You undress the baby.
Yes.
Okay, let me use this.
Yes, let's use this.
This is my bath station, remember? So, Baby Mercy, you always make sure you're holding and protecting the neck.
Yes. Oh, it's still that time when the baby's neck is very wobbly.
Yeah. So you have to be so cautious. So you can start with the eyes. So you wipe the eyes inside out
Okay.
with your bath towel. Give me one of
This one.
these.
Okay.
Yeah. Just bathe the baby and then the whole face.
With no soap.
With no, okay, you can use soap,
can use,
but not on daily basis.
Okay.
Yeah, at times soap tends to dehydrate the skin.
Okay.
Yeah, so you can use the soap or not. Okay.
Okay.
So the head, and then there's no any procedure of how to. But now you must start with the eyes and the face, just a normal wash.
Okay.
Okay, and then the neck. Remember where there are creases.
Yes.
The neck and
Usually
times-
the hands. Yes.
at times the armpit and around the elbow and the thigh here and at the back of the leg.
Yes.
Is there anything I've missed out?
No, actually you haven't.
Okay, so now you continue bathing the baby. Bathing. And then,
Entire time we're still supporting the
The
baby's neck.
yeah.
All right.
Remember the spine is still weak.
Okay.
And then you can have a small container that you can fetch water with and rinse off the soap.
Okay.
Yeah, if you used any soap. And then prepare a towel for me.
This towel of mine.
Yeah.
Still placed. Now this is it's no longer our bathing station.
Yeah.
Beautiful share.
So sure. And then you dry off the water. Remember to keep the baby warm. Dry off the water. Then you protect the head because most newborn tend to lose warmth from the head. So you protect the head, and then remember we have a cord to take care of.
Yes.
So we've already washed the baby with the lukewarm water. So ensure you dried the area properly. And then you wipe. And then as fast as you can, because you don't want to put the baby in so much moisture and cold surfaces.
Yes.
So you change the towel.
We change the towel.
Remember we are supporting the neck.
Wait, can we
You can use
use
one
this? Oh, this other towel.
other towel.
It's now our other towel.
Yeah. And then if you have a moisturizer, a very mild, not scented, a mild moisturizer you apply on the baby.
Okay.
Don't apply on the cord. Remember, we have something for the cord.
Okay.
Specifically for the cord. And then we go ahead and dress the baby.
Yes.
Yeah. So baby Mercy will be putting on trousers today.
Okay. And a top to match.
And a top to match and a diaper. We can start with the diaper.
Yes.
Because we don't want her to pee. Yeah.
Yes.
It's okay, but
Yes. Boys are the ones who pee facing up. So that time you're changing,
they can really mess
they
you
can
up.
pee on you.
Yeah. So let's assume this is a cord.
Okay.
So you don't apply the diaper on top of the cord.
Okay.
Because in case the baby messes or urine is there, it's too much, it can get to the cord.
Okay.
So you can, let me show you. Where's that? Then you fold this way.
Do I fold after or can I fold
You
before?
can do it before
So
or
that
after.
it does, I avoid the area.
Yeah, you
Okay.
can do it after or before.
Okay.
Yeah,
The diaper will always come below the navel until it falls off.
until it falls off.
Okay. All right.
And then remember you're covering the head.
Oh, yes.
And then the trousers.
It does not feel cold.
And then the pants on.
And we have warm clothes. We have to also have mittens,
And baby
socks, a
blanket.
baby blanket,
Yeah.
a hat.
Hat is so essential at this stage.
When they're very, very young.
Yeah.
This one is a newborn.
This one is a newborn baby. Mercy is 2 days old. And
But
some
the
socks
pants will go below.
will go below. Oh, thank you.
Yes.
Below the
Below our navel.
Yeah.
The baby's navel.
yes. So that's 8. And then the shirt
Yes.
supporting the neck.
I remember this stage, I was also very nervous. I was trying to avoid any clothes that would have to go over his head because I was really, really scared.
Yeah, especially dealing with the neck.
Yes.
At this stage,
At this stage, yes, it's very
it seems the clothes are not
and
fitting.
not
Baby
fitting.
Mercy. She has gained weight.
Today.
Let's try. But be gentle with a real child. This is a dummy.
Yes.
Yeah.
Yes, we will take good care.
Yeah. Take care of the neck. That's pretty messy.
Yes. All dressed
Well
and
dressed.
ready to feed.
Yes.
So that's how we bathe, that's how we dress our baby.
Let me try and bean it here.
Okay.
Then this way.
These clothes were made for her. They're
These
very well
clothes-
fitting.
Mama bought them for her specially.
Okay.
Yeah.
So now we hear that it's usually best to breastfeed your child immediately after birth. So is it better to breastfeed immediately after or before we take baby for bathing? Which is
It depends on your baby's demands.
okay.
If you can start bathing a crying baby, so you need to soak them first
Okay.
and then continue to give them a bath.
Okay.
Yeah.
Okay, so Nurse Damaris, I think now that we have our baby all dressed, we can look at the correct way to breastfeed our baby. So that at least our viewers can have a clear view. I will just gently move our bathing station, dressing station. Perhaps you can have a seat over here.
Okay, thank you.
Then I will just be here close to the baby, you can now just show us how to properly now breastfeed baby Mercy. Okay.
So first, as a mom, you make sure you are comfortably seated, and because we don't want you to develop back issues. So make sure you're comfortable, so positioning. And then if the baby has mini clothings or coverings, you reduce them to enable skin-to-skin contact.
Okay.
So then there's also the positioning. You see the ear of the baby and the shoulder and the hip. Make sure they are aligning like this. And then your tummy and the baby's tummy, they're in contact like that.
Okay.
And then the baby's nose and your nipple, make sure they are. Hey, baby Mercy is tall. So no, I'm not comfortable. Make sure that the baby's nose and your nipple are facing each other.
Okay.
That's the correct positioning. And then for the latch is you are touching the baby to the breast now. You see the lower lip of your baby. Make sure it's outwardly turning.
Okay.
And then the whole of the black area is in the baby's mouth, not just the
areola.
nipple. Yeah, the areola. Okay. It's in the baby's mouth, not just the
nipple.
And then you'll just hear your baby suckling. Yeah. And then if you have a nursing pillow, you can place it under the baby for the comfort and the positioning to ease your back and to help with your back. So make sure you breastfeed the baby on one breast until it's fully emptied, at least 20 minutes. For the first 10 minutes, we have the watery milk that is produced. Then 10 to 20, that's when we have the healthy milk with the antibodies and the proteins and the fats. So that's why. So remember, all through breastfeeding, your hand is holding the whole of the baby's body, not half of it. Okay?
Yes.
So this way, and then now the baby is full, we go ahead and burp the baby. I support the neck.
Yes.
And then my burp towel. Okay.
I can help you as baby.
Thank you.
Wants to.
Okay. So I'll teach you on this position, which is common. So you burp the baby like this, and then supporting the neck. The other method, you can try sitting her up and like that.
Okay.
Or this way. You see, I'm still supporting my neck.
Yes.
And then you
gently rub
to ensure that if in case she swallowed air, it's out.
Okay.
Yeah. So that's it. That's basically it.
Okay.
Baby Mercy has already burped.
And now, baby, I can see she's even starting to fall asleep.
Yeah, we need to put her to sleep.
Okay.
Yeah.
All right. I think that covers it all. At least now we know how to bathe our baby, how to breastfeed, making sure that the baby has latched correctly.
Yeah.
Also, we know how to burp our baby. So I don't know if you have anything else you want to share with the moms post-delivery that you think you may have missed and you feel it's key to them for them to know.
Okay. Remember, motherhood is a journey that you should enjoy.
Okay.
So you see those moments when you're breastfeeding, they are interactive moments with your baby.
Yes.
So communicate with your baby, tell them you love them, and welcome to the world. When you're bathing them also, you can sing songs to them.
Okay.
So it's a good bonding moment for mother and also the family.
Okay.
Yeah. I would want to tell every mother out there to keep enjoying motherhood. And thank you for keeping it here.
Thank you so much. So as you've had it first, always remember to enjoy motherhood. Taking the small moments, share that moment also with the other family members. And if you have any questions for Nurse Damaris, how can they reach you if someone maybe felt you said something or they would like more elaboration?
Okay. I'll give out my email address.
Oh, you can share that. I guess we can put that in our description box.
Yeah.
And also you're at RFH Kiambu Road. So anytime, are you there always? Are you available during the week?
I'm available all through.
Okay.
And also, you can put down my Facebook account.
Yes, we'll add her details in the description box. So if you have any further questions, you'd like her to assist you with anything, please make sure to check out the box. We'll put out all the details. So that, guys, marks the end of this episode. I hope it was as insightful as it was for me. I've actually learned something new. And until next time, it's been a pleasure as always. Do not forget to subscribe. Give us a like if you enjoyed the episode, and share with everyone that you know who will benefit from this. So until next time, it's been a pleasure. Bye-bye.